there's an echo over there. Well, there you go. We're halfway into the opening day, and we are talking all about medical cannabis, how the medical market in Mexico that opened last January needs to learn rapidly from the experience driven by the market that came before us. And for that, and for a few more insights, I'm thrilled to welcome to this stage, Heather Allman. Hi, Heather.
Hello, thank you for having me.
Well, Heather is a journalist. She writes for Cannabis Law Report, as well as the CBD World News and Leaf Report. She covers cannabis, CBD, hemp, and I think we have been talking for a little while, and she has a really great story that she wants to talk to us. So thank you for being here, Heather. We have some slides here. We have all the things you need. Welcome to your stage.
Thank you. I'll go ahead and get started. I appreciate Logic hosting this event. I'm happy to be here. I am, as he said, a journalist for Cannabis Law Report, but I am also a medical cannabis patient here in Florida. And we are up to about 500,000 patients. So I am far from alone. And I'm here to just talk to you a little bit about the basics of, what neurological disorders and symptoms cannabis can be used for, what types of delivery methods we can use to get that cannabis to our patients. And then the third part of that's going to be, why is this effective? And I'm going to go over a little bit of research there. So I'm just going to go ahead and get started. I wanted to start with a quote from the American Academy of Neurology. Did a review in 2018 looking at the various forms of cannabis and their effect on neurological conditions. They found the most research proven for multiple sclerosis, which is why it was added as a medical condition in many states. It was added here in Florida in 2016, and I became a patient in 2017, and it literally changed my life. I went from existing on 26 medications to living a life like I have now, what I'm doing, on only 6 medications. And all of that is because of a plant. Wow. So I'm very excited. Yes, and I just wanted to show you the first slide here is really about, the two major cannabinoids, THC and CBD, may be effective for several neurological conditions. And I know a lot of people, especially those in the medical professional community, are very aware that the nervous system has been taught in medical school. Unfortunately, that is not the case for our second slide. Our second slide that we have, next slide please, is the endocannabinoid system. And I wanted to put this up here to kind of give you an idea of how large and how widespread the endocannabinoid system is in the human body. And so for neurological conditions, you can see all of the benefits there. You have CB1 receptors mainly in the brain, the central nervous system, the muscles, the vascular system, and the lungs. You also have CB2 receptors in the immune system, the spleen, the skin, the colon, and the bones. We also have reproductive organs in there, as well as the liver and the pancreas. So you can see that cannabis, our endocannabinoid system that we have as mammalians or humans, is very intricate, and there are several different ways that you can use that to help patients that have neurological disorders. So first of all, I'm just going to talk a little bit about the disorders and symptoms you can treat with cannabis. And those start with the A's. We have autism spectrum disorder, ALS, Alzheimer's with cognitive impairment, anxiety, depression, epilepsy, multiple sclerosis, of course. We have neuropathic pain, Parkinson's, and PTSD. And those are the main conditions that most neurologists look at, or cannabis doctors look at, when it comes to treating a patient and thinking, are they eligible to have a cannabis treatment? The reason for that is, as we know, most of those conditions come with a variety of symptoms as well. Multiple sclerosis came with anxiety for me, and came with depression, came with sleeping issues. And we know that cannabis can access that part of the brain that affects memory, mood, focus, appetite, a lot of the issues that these condition patients are struggling with on a daily basis. I was one of those patients. And once I started using cannabis, I was able to stop a lot of my pharmaceutical medications as I saw different types of cannabis work. The important thing to remember here is that in the United States, you cannot call a cannabis, it's called a recommendation. It is not called a prescription. It's called a recommendation, I say, because there's room for personalization. With a prescription, you have to go to a pharmacy, you get the drug that's prescribed, and you have no room for substitution, nothing that's personalized about that, except for what your doctor has already seen. When it comes to legal cannabis, if you go into a medical cannabis dispensary or in the future, any type of cannabis establishment, you're going to get cannabis that has been tested, regulated, has oversight, and it is a measured dose of cannabis. And that is a really important thing to remember, that even though the patient has a recommendation and they can go in and they can choose what works the best for them and personalize their medicine. And we live in a day and age where we're really trying to get people to take care of their own health, be better health advocates. And I think one way to do that is to really experiment and to find out with your doctors, of course, what is an option for you when it comes to cannabis treatment. So I would just like to talk about a little on multiple sclerosis side. I have seen amazing results in the neuroplasticity of my brain, the neuroregeneration. I've had quite a bit of neuroprotectant going on with my cannabis use that is supervised. And I've also seen the absence and complete, gone of my spasms, of my nausea, of my depression, of my anxiety, and all of this is because of my cannabis medication. And I do consider it completely medication. It is not something recreational for me personally. I use it because I don't want to use the 26 drugs I was using prior to using cannabis. And it's really amazing when you start looking at those CB1 and CB2 receptors, that they affect everything from our brains to our bones, to our reproductive system, to our skin. And that is why the next part that I'm going to talk about is the how. How do we treat some of those disorders with to use some visual aids, so that you get an idea of the different delivery methods that are out there. So if you could go to the next slide talks a little bit about this. It repeats some of the information I just told you, where the CB1 receptors are mostly located in the brain and central nervous system, and the CB2 receptors are mostly the immune system and the peripheral organs, including, as I said, nerves and skin. And we know that pain, muscle spasms, epilepsy, seizures, these types of things are related to the brain, the central nervous system. We don't know exactly how in every case. We don't know exactly why, but we do know that all of these conditions are very personalized. And I do believe that cannabis, being a personalizable medication, is very convenient. For example, if you want to use an oral cannabis extract, most people think of a traditional tincture bottle where you have a dropper of oil that you put under your tongue. But this is just one way to get oral cannabis extract. There's a number of ways, one of which is a concentrated CBD or THC powder. This is actually an oral powder that can be mixed into beverages or food if you have geriatric or pediatric patients. So that is another delivery method. You also have nasal sprays. These are very popular with pediatric patients because it's not any type of inhalation. It is a typical nasal inhaler. And that is another delivery method that's very convenient, and you can take it on the go. Of course, we can't forget about edibles that come in things from gummies to chocolates. You know, we have a variety of cookies. I mean, anything you can think of to put in your mouth. Everyone just has the idea that cannabis has to be inhaled or smoked, and that's just absolutely not true. There are so many options. For example, if you wanted to use another type of oral cannabis extract, there are MDI inhalers. So you get an atomized spray of cannabis, CBD, THC, a ratio, and there's no exhale. You're not vaporizing any type of combustible item. And you also have concentrates like the RSOs that can be added again to any type of food or beverage. And these are very convenient for people who want a little bit more because they have more pain and they need a little bit of a boost that they can't really find in some of the other delivery routes. But we also have very easy soft gels and capsules, and these look just like typical pills. We have your typical soft gel, we have a capsule, and this is actually a CB1 capsule, so it's very convenient for sleeping. But these are also something that people that are on a regimen of medication already can easily add into their regimen without much change to their behavior, which is very convenient for people who have neurological conditions that affect their memory. Because cognitive impairment is always something that people are afraid of when it comes to cannabis. But I am here to tell you that in my case only, I can't speak for anyone else, but I have actually been quantitatively measured to have cognitive improvement. Since my use of cannabis started in 2017, I have discontinued the use of drugs like Aricept and Exelon in lieu of cannabis because it actually has started making new connections in my brain. I have what is called tumefactive relapsing remitting multiple sclerosis. That means the lesions on my brain are about the size of tumors. So they're huge. And my brain has found a way in the last 5 years of cannabis use to make new connections between those synapses that have been broken, that myelin that's been broken down. And that is also the case for many other neurological chronic conditions, such as Alzheimer's, or, as I said, depression and anxiety. I also wanted to show you that convenient, and everyone has heard of the vaporized cartridges. These are the cartridges that just go on your typical vape pen, and those can be used very easily as well. When it comes to the study that was done by the American Academy of Neurology, they looked at oral cannabis extracts like the ones I just showed you, and they put them in comparison to the synthetics, and that would be the Sativex, Marinol type pills that are often recommended, and the oral sprays that are such as Epidiolex and others that are in an oral spray form. And what they found was that the oral cannabis extracts were more effective in reducing especially spasms and sometimes tremors. Not all types of tremors, not tremors from Tourette's, for example, or Huntington's, but tremors from MS, some tremors that come from Parkinson's, and also a lot of tremors that can come from epilepsy and the after effects of that. And as you know, muscle spasms are extremely painful. They are very extensive, and almost every neurological condition has some sort of spasm involved, whether that's a spasm or a contraction of a muscle. Both of those things occur with these chronological conditions, with these neurological conditions, excuse me. And if you incorporate a cannabis regimen into a patient's current regimen, or in spite of that, You can substitute one or you can do both. As I mentioned, I do still take 6 pharmaceutical medications. Those are medications which clearly I have to take because cannabis cannot cure multiple sclerosis. It is not a cure. It is not a panacea. It's not great for everyone, but it is something that I think is worth people opening a discussion with their doctors about. A lot of doctors are very reluctant to talk about it to the patient unless the patient comes forward with that conversation first. So all my goal today is to arm you with some information about what's already in your body, that endocannabinoid system that's just waiting for those delivery methods of cannabis to come fill up those receptors. When those cannabis delivery methods hit those receptors, all kinds of great things can happen. And I would like to talk about a little here and the benefits that were found when it came to substituting pharmaceuticals for cannabis products. And this study looked at things that I personally have also found effective. For example, since there is so much activity with the anti-inflammatory properties, the antioxidant properties, the antidepressant, anti-anxiety properties of cannabis, I was able to completely stop taking a lot of antidepressant medications, as well as I said, memory medications, as well as arthritis medications, neuropathic pain medications, muscle spasm medications. I was able to make my body respond a little differently. 5 years ago, I was in a wheelchair. I had half of my body was not usable. The left side of my body was paralyzed. I had trouble speaking. And all I was given was more pharmaceuticals. I am completely free of opioids, anything related to an opioid, I take none of. I use all of my pain medication. I also use things like transdermal patches. Of course, there are creams that you can use on skin, as well as things like a balm that's like a chapstick that you can rub right on your skin. So if you're not a fan of the oral cannabis extract, there are plenty of other options out there for patients who want to open a discussion with their physician, with their family, anyone who really wants to listen. And here we go with the third point, was the evidence for safety and effectiveness of medical marijuana. As I said, for MS spasticity and related symptoms, it was very strong with the oral cannabis extracts. It probably does not lead to improvement on doctor performed tests. So that means that just because your doctor performs a test, it may not necessarily give him the same results that you're experiencing personally. But the oral cannabis extract was found by the American Academy of Neurology to have very strong effect on muscle spasticity. On the next slide, the next slide talks a little bit about the synthetics, I believe, and the synthetics are probably reduced spasticity, but it was only a moderate finding. That shows that synthetic THCs were not as effective as using the entourage effect you get from the whole plant medicine found in cannabis extract. Even the oral sprays, nabiximols, were found to only have moderate results compared to that oral cannabis extract. So as you can see, these are just symptoms that were related to muscle spasms, but they also studied bladder symptoms like frequency of urination and control. And while cannabis is not known, has weak results when it comes to incontinence itself, it does have moderate results using oral cannabis extract for neurogenic bladder, which is something that comes along with many of these neurological disorders, from Alzheimer's to multiple sclerosis, to ALS, to Parkinson's. Many people have bladder dysfunction, and cannabis has shown to have moderate results with bladder dysfunction. when it comes to that oral cannabis extract. So I guess that my presentation here was just a way to kind of start a conversation and have you guys start talking about what conditions you think could be treated, what conditions could be helped, what symptoms do you think your patients are experiencing that maybe they're not getting relief for, or they're just taking another medication for. They get nausea from one medication, you give them an anti-nausea medication. What if you were to try an oral cannabis extract at that point? So all I can say on my own behalf is I feel like I have a quality of life now instead of just quantity of life. And I really think that's what it's all about, is having a life that you want to live. And I am lucky in that I have been able to use it freely here in Florida, as it's legal for medical cannabis use. And I've been able to increase my neural function. I've been able to increase my physical function. And all of these things are closely monitored by my physician staff. This is not something that I do alone, nor do I recommend. No, do not recommend doing this alone. And I also think people really need to track their cannabis use if they do decide to use it as a treatment. Write down what you use, write down how much you used, write down how you felt. These things come in handy when you go back to talk to your doctor, and they can talk to you about that recommendation so that you can make the best choices when it comes to the dispensary. When it comes to that, I want to talk a little bit more in detail about how cannabis, some people think, can be very cost prohibitive and are very tempted to settle for branded CBD that is very easily purchasable in many countries. And I would just say that the word of caution there is only that you need to make sure that quality of what you are getting has been, as I said, highly regulated, has high testing standards, and has oversight to the process. A lot of CBD companies operating under the 2018 Farm Bill here in the US do not have the same kind of regulation or oversight that you see in the cannabis industry. So that is something that I think, one versus the other, I would always say to go with the medical cannabis or the cannabis that is legal in your country, in your region, in your state, and never stray from that unless you are using the advice of your own, personal physician and physician staff.
Good. Thank you, Heather. What an amazing story. Thank you for sharing. We have some follow-up question, basically, of what we're talking. What you were saying, it's indispensable. Just keep talking about it. Keep saying. Keep thinking about cannabis and their different uses for our own health, right? So the first follow-up question would be, why do you think all over the world, mainly in other countries, as a journalist, you may know that doctors not always know about the endocannabinoid system. They don't know how to treat. They don't even get to learn it in medical school. Why do you think would be that? Or what is your insight on it?
Well, my insight on that is because of the 1937 Marijuana Tax Act, which is what prohibition started. And with prohibition, we decided to just ignore an entire system in the body. So it wasn't put in textbooks. And a lot of these doctors have not had the opportunity to learn about this. And I think that, that is why the patients need to start doing a little bit of research on their own so they can come to their doctors. And there are a lot more programs opening up, CME programs for physicians across the country, across the globe. We're seeing them in Canada, we're seeing them in Mexico, where they're starting to open up the field so that these doctors who are working in, let's say, pediatrics or orthopedics are starting to realize, maybe I can learn more about the system that I didn't know before, because it's obviously helping some of my patients.
So the power is on the patient side right now. Do you think that?
I think it is, because the patients have the most power right now. The doctors don't always have the access, but patients have the internet. We have the ability to ask questions. We have the ability to ask questions and find credible sources and come to our doctors and say, why is this something you don't know about? Can we find out more about this? Can you tell me somebody who knows about this?
Yeah, so that's great. The other thing you showed us, there's a lot of ways to take cannabis, right? From CBD, from the different dosage. How you think a patient that's starting with it should go after the doctor for dosage?
I think most doctors like to start with a dosage of about 2.5 milligrams to 5 milligrams, which is that's like one spray is about 2.5 milligrams. Start low, go slow is the rule. Start with a low dose, go slow as you build up. Don't start at the top. Find out the lowest dose that works for you and makes you have that homeostasis or balance in your body. You shouldn't feel high. You should feel balanced. When you feel high, you have too much. If you feel balanced, you have just enough.
Good. And the last one, as a journalist, how do you think, or what's your view on where the world is going with legalization all around us?
I do think with you guys leading the way now after Canada, the United States, we have the Democratic Congress right now. They are looking at the MORE Act and the Safe Banking Act. And I do think that the United States is going to be, by 2022, they're going to have it legalized. That's my opinion. It's my informed opinion. By all the people that I talk to pretty much have the same projection. The problem really here in America is the hang up is with trying to pass a big omnibus or comprehensive bill all at one time. We need to go, like I said, it's the same rule. Go low, start low, go slow. And we need to try to push that through one bit at a time, because it's not all going to come at once.
Wow. Well, nice. Heather, is there a link or do you have an organization or somewhere where our audience can reach you, can know about a little bit more about your story, or are you doing something about that?
Yes, you can actually go to cannabislaw.report, and my column is entitled Lighting Up with Heather Allman. And I talk about lighting up with Heather.
Lighting up, yeah.
And I like to illuminate, and I like to use cannabis. And so I looked at it as a good way to open a conversation because it catches people's attention. But you can get my contact information. You can send emails to me through that as well. You can also read any of my work that's been published so far. I've been publishing for them since 2019. So there's quite a bit body of work there for people to look into if they're interested.
Well, Heather, let me see if I think we have some questions from the audience. Okay. Let me see.
Excellent.
No, there's the database. They put your link from your site. So you have anything else you think it would be valuable for our audience? I think it's been a great talk. You covered everything that is needed for a patient, everything that is needed for your journey, what you've been doing. Some other words for us?
I would just like to close with, that really we don't know the full potential of what these cannabinoids hold in store in the future. We're just now getting started doing research and clinical trials, and this is on a very limited scale because of it being a Schedule I drug. If we can start the descheduling process, I do believe that we could start doing research and clinical trials instead of just anecdotal evidence, people like me. I did see a question pop up about side effects.
There you go.
I personally have not had any side effects personally. I have had nothing but good success. But as I said, I started very slowly. I started very cautiously. and I have not had any ill effects, except for I had one episode of having a little less focus than I would like. And that was due to my own imbalance. I wasn't quite at the right spot. But other than that, that's easily fixable because CBD helps cancel out any side effect you might get from the THC, or you can just go straight with CBD.
It's an all-around medicine, all in a plant, right?
Yes.
The THC and the CBD just balance itself out, and it's just amazing how this medicine is gonna be featuring, but it's gonna be forming the next few years for our own medical benefit. So it's really amazing.
I'm really excited for you guys. I can't even tell you how lucky I think you are. And I really see great things happening in Mexico in the future when it comes to medical cannabis and the cannabis market in general. I do see that, you know, regulatory frameworks and banking and tax frameworks already being set in motion. Exactly. And I think that, you know, that's definitely, you're all heading in the right direction, and hopefully the United States will catch up sometime soon.
Yeah, we're starting medical protocols here in Mexico for different drugs. We're starting all the investigations, all the research here, and I think it's going to be a thriving, well, not only a market, it's going to be a thriving research community that you're going to be hearing about us really, really soon. And we invite you to be in touch either with Logic, with everybody here, so we can be just like somebody that can give you all the insights of what's going on. And
yes,
help you in anything you want.
I would love to do an interview one day with Logic and with your staff and just see where you guys are and publish it for Cannabis Law Report. So I definitely will be in touch. And thank you all, everyone. Thank you everyone for coming and listening. I appreciate it.
And Heather, we have a club in Clubhouse. You know, do you have Clubhouse?
We don't. Yeah. I don't know.
Well, you should get Clubhouse. It's a new app. It's a really amazing app that you can just peek on it, and it has like a stage, and people come around, and you can share your story, and it's really amazing. We have a community there called Cannabis in Español, but we do an in English program once a week. So I'm gonna invite you personally so you can share us your story there. All right?
That sounds fabulous. Thank you. I definitely will be enjoying that.
Yeah. Well, Heather, thank you very much. Guys, Heather Allman was here with us. Thank you for being here. This is the first day of the Mexico Cannabis Summit, and we're really happy to be here. Thank you very much. See you in the next one. Thank you, Heather.
Thank you. Bye-bye.
Bye-bye. Ciao.